Hey y'all, it's Lauren, and you're listening to Social Workers on Fire. And today I have Mick with us, and Mick is actually one of our student interns. And before I let him explain about himself and give a little history, I just want to help really people to understand about Mick and how he's different in terms of our usual interns. Mick has actually been with us for 3 semesters, and we'll get into that later of how he ended up here for 3 semesters. But typically when we have interns, they're here for 1 semester and then they move on or graduate or whatever their circumstance is. And Mick is also unique in the sense of usually when interns come in, they don't really have much experience. They haven't had other placements or other jobs, but Mick actually has a wealth of previous job experience. And so he brought just a different view and a different aspect to our typical interns that we get, which is why we have him here on this podcast with us today. And so, Mick, if you'll just kind of introduce yourself and give that background information to them.
Yeah. Like Lauren said, I am not the typical intern. I am an older student who graduated with an undergraduate degree from the University of Alabama in 2003, I believe. So it took me about 2 decades almost to come back and get my master's.
It's never too late.
Exactly. It is never too late. So when I enrolled into the MSW program, I had 20 years or more of practical experience in a wide range of areas of social work, or just community kind of work. Lots of nonprofits in different places like that all come together. And so, I graduated in 2003 with my bachelor, 4.0 in psychology. And with a minor in criminal justice, as I wanted to do law at the time, and did do that for a brief amount of time, and decided it just was not for me, was not a personality match. So after that, I ended up, by happenstance, applying to work at the Department of Human Resources, or otherwise known as DHR. And I worked in the as a foster care caseworker and a child or family preservation CPS. It changes and varies where you live. And I did that for several years. It is a very interesting job. It teaches you a lot of very valuable skills, I will say that, that can be applied just about in anything you do in and out of social work. After there, I ended up working on a community level at my local Chamber of Commerce in the county where I reside. And when I worked there, I worked underneath the director. We're a small county where I come from, so there weren't many full-time staff. But we did a lot of community-based programs for leadership, helping to take care and promote programs within the community to help educate adults and youth. We also did Washington fly-ins, where I would coordinate those and put those together. We would get different community members, business leaders, and fly to Washington and meet with our senators and representatives to, promote programs and request funding for things that we thought would be helpful to the community. And that was an amazing experience. And you find out just the trickle down effect of how it goes all the way to the top and comes back down, and how important it is.
I'm curious, what was like your title there?
When I was hired, they did a capital campaign to raise money for a full-time staff member to be brought on board. And they had a whole vision for what they were wanting to do with it. So at the time, it was a retail and commercial director.
Interesting. Okay.
But as with any kind of nonprofit agency, your role changes and adapts.
Yes.
And so I kind of purchased software to help promote our county and bring business, which had a lot of statistics about,
Yeah.
our county to help sell us.
Yeah.
And so I was trained on how to use that and would put together portfolios of um, what Walker County looked like to help sell it to people to come and bring business or,
Yeah.
you know, promote local spending.
And I think it's so interesting because you came in as this retail, director specialist, but then you ended up, in a sense, doing social work,
Mhm.
advocating to get grants and to get whatever you guys needed for your community.
Yeah, exactly.
So you just don't hear about that very
You
much in the
don't.
social work profession. So,
Most people wouldn't think that that would go on in most chamber of commerces, but
right.
that is an aspect of it. You
Yeah.
do learn grant writing and do community-based programs that interact with social work and other nonprofits. It
Yeah.
helps you learn between that and DHR how your community functions as a whole.
Yeah. You got a big
Yes.
world view of all of it. So you finish at the Chamber of Commerce, and then where do you go?
After that, I ended up going into the school education system. I Even though it took me 20 years, I do love learning. I am, a book nerd. I do enjoy learning new things. I think there's always more to learn,
Yeah.
and it's just to better yourself to just keep on learning. So, and I always enjoyed working with children. And one of the things, because we did a lot of leadership with the youth programs at the chamber, so it was kind of a natural fit. And I ended up working with in a self-contained special education classroom because
Yeah.
I didn't have the background educational wise,
Right. Yeah.
but practical wise and experience I did. So
Yeah.
I did work with self-contained students who were either physically or intellectually disabled, and it was so rewarding.
That's a big shift from the Chamber of Commerce to
Yeah, it was.
yeah, but a different sense of rewarding,
Oh yeah,
so
it taught me about another. I did have a DHR, children that had some behavioral issues or things like that, but this was much more one-on-one
yeah,
and being right in the middle of it. So it also was another learning lesson.
yeah. So then you decide to go back to school and get your master's.
Yes, that is just an odd story. Pretty much just because I ended up reaching out to an old DHR coworker
Okay.
who did the same thing, and she kind of gave me the roadmap to applying for the master's program into what I wanted to do. And the end goal, what I thought set out to do, she helped give me the tools to get where I was
Yeah, that
going.
little
'Cause I had
push.
no idea where I was. That was part of this being stuck. I
Yeah,
didn't know what to do.
what to do next, yeah. So I know we were not your first internship, so just tell them a little bit about your internship, where you were at, what you did there, so we can kind of compare it to
Yeah.
what you do here.
My first internship was actually at Capstone Medical Center in Parish in my local county where I live. But the week before we were supposed to start, the entire placement pulled out of the program. So me, along with about 10 others, had to be placed.
Ooh, I would
Uh,
have been panicking.
oh, yes. It was, I had no clue where I was going to wind up.
Yeah.
And so I was placed with, or matched with the University Medical Center on campus,
Mhm.
which was exciting to me because I love UA and I love coming to the campus. And
Yeah.
and then that setting was a whole new experience because I was not really familiar with hospital social workers outside of DHR,
Yeah.
which again, I apologize if I reference it back too much. But as in medical, clinical, social work, and what you do in those settings, it was a whole different setting, and had to learn how to document differently.
Yeah.
Just the different protocols behind it. It's much more even more strict than you would think families would be, but
Right.
just because of HIPAA and
Yeah.
privacy stuff. So yeah, that was my first official placement.
So what did you do there? Like, what were your roles?
Uh, we would alternate through different stations, so to speak. One would be in the intake office. So if people came in to, they had, or to apply for they had a type of, for low income families, insurance healthcare coverage policy called CommCare, I believe.
Yeah.
People would come in to apply for that, ask questions, renew their policies, or come in for any kind of social work related need that either the front desks at reception or somebody in the doctor's office may have sent them to us for. Medication assistance was another one.
Right. So
And
just kind of linked them to
yeah,
resources.
and sometimes when the people would call in
Okay.
about things, it would be directed to the intake office, and you would answer the phone calls and try to connect people.
Okay. Cool. So your internship there, you leave there and you come here.
Yes.
And so before Mick kind of dives into what he did here and his experiences and views of his internship here, I just want to explain the difference between his internship with UMC and then our internship here, what we do with our interns. And so with UMC, it is a doctor's office. And so you're in the office, you're seeing patients, you're making phone calls as expected in a doctor's office. But here we go out, like we've discussed, in the field. And so what our interns are expected is that when they first start, they shadow us. And so they come out on the home visits with us and watch the biopsychosocials, hear how we talk to the clients, come back to the office, see how we make referrals, learn about all the resources in the community. And as they get comfortable and feel confident in their ability to do that, then we still go out with them, so they never go out by themselves. But we go out with them to see our new patients, and now it's their turn to take over. And so they're expected to lead the biopsychosocial, to do the follow-up visits, make the referrals, the phone calls. Essentially, that client becomes their client, but we're still here as guidance as needed. Our interns also have some other small things they do. We have a pantry that we take donations for clothes, non-perishable food items, hygiene, stuff like that. So when we get donations, our interns help us with that. It is a lot. They also help with like our social media posts. And then we typically do social work hubs once a month where we go out into those low income communities and try to do that prevention aspect. And so when those people come up to us at the social work hubs and ask about resources in the community, it's actually our interns that are sitting at that table answering those questions, pulling out the resource guides to give them. And again, we're there if they don't know the answer to questions, but they kind of lead that. So with knowing that, Mick, can you just kind of tell us about your experience, what you saw, what you thought about the internship as a whole?
The internship, just to start out, when I was matched here through the field office, as you typically are supposed to do, even outside of school with interviews, you need to look into the place you're going to go.
Yeah.
So you have some questions for yourself, and try to learn what you can. At that time, was not a very wide-known program. I could only find one or two things online about it. And it was interesting. I just could not really get a full grasp of what it was that I was walking into fully.
Yeah, we were still trying to get our name out. Yes.
Yes. And that will change by the time we wrap this up.
Yes.
You can find a lot of information now, just based on the growth. But yes, and being linked to, fire and rescue, that I did not know what that would entail.
Yeah.
So, and going from a clinical office setting to
now hearing you're with the fire department.
Yeah, fire department.
You're like, what?
You don't know. What am I doing at the fire department?
Yeah.
And so, I came in kind of blind to it, and it has just been an amazing experience on so many different levels. Before I came here, yes, I'd worked with a lot of different communities, groups on different levels, different socioeconomic, levels as well.
Yeah.
And I came here and I learned more about this community since I've been here than when I lived here to go to school. I literally lived, I would say, right down the.
You did live right down the road.
Right down the road. Did not know a thing about this community, where things were, what needs were around me at the time, and when I got here, that was something that I was happy to learn because at my previous placement, you didn't know. You didn't get out of the office. So trying to refer people to places was very difficult. And so coming here and learning the community and seeing these needs, I really got to know where would these people need to be referred to if, that's what we needed to do. We couldn't help them directly.
Yeah.
Um, and just what the needs were in general in an area I had lived in, didn't know and knew nothing about.
Yeah. I know one of the things I was just going to get your views on this and how has it been awful? Has it been not that bad? But I know a lot of warning we give to interns when they come is regardless of these people's situation, we're going to go meet them where they're at. We don't require people to come to us. So we go into condemned houses
Yes.
and deplorable situations. So kind of how have you handled that as an intern, walking into these things? You never know what you're about to expect.
That is true. That's an important lesson and aspect of social work in any setting, but especially here, because it is one setting. It will be completely different from the one you went in just an hour earlier, probably.
Yeah.
But is to meet whoever you're working with where they are at, and just kind of going in with that you're there to help meet their needs, and to just the background setting is just what it is. It's the background setting.
Yeah.
The client and their needs are what is you need to focus on, and that's where the assessment process is just very important in building that relationship. And that's what I think is one of the key things I have seen here is the relationships, and relationships are key to social work for it to be effective. But at EMS Prevention, the relationships that I've seen been cultivated between the clients and Lauren and Brianna and among other social service agencies to get these needs met and for the people in the community it's amazing. I just see it happen in real time.
Yeah. So what would you say as far as the internship, what has been your favorite part?
It's a great place, and it taught me, I came in with 20 years experience, thinking I knew a lot to do. I had to be reined in a couple times with not because my knowledge was not, as far as I thought it was. I learned a lot about documentation, but there's a sense of, as it being fire and rescue, you're there to help. You're helping, entity. So it's a, very camaraderie here is very it's everywhere. You have to work together to get these things accomplished, and that and just being able to be on the go constantly, that is exciting to me. The adaptability, learning that, and just being flexible, and just seeing the different situations that you meet these people at.
Yeah,
that's a great aspect of interning here.
Now, preface this before I ask Mick this question. Today is Mick's last day. He has passed this field placement, so he is free to say whatever he wants.
Finally.
So, Mick, what would you say is your least favorite part of the internship?
Oh, this is difficult. It's hard to say a negative, but just because I've just enjoyed it so much, and I've learned so much. And I have learned a great deal, because there's a lot of not just because it was a community I didn't know much about, but there are people, and I've mentioned to you senior citizens and different populations that I've never really realized what their needs were, and that I've learned that here. But the only negative I can think of was, I'll say I have issues with adapting to technology, and so with helping some clients and trying to come up with ways to meet their needs, have been ways I've seen be introduced that I personally wouldn't be able to just think of, or just you probably even show them how to do it, because I myself need to be educated on it. So like I said, I don't think there is anything that I can say that is just terrible, even though I have a free pass right now.
Well, we appreciate that you can't think of anything. So I'm gonna kind of circle back to we talked about Mick being here longer than most students. And so initially he had some things that caused him to have to extend into another semester with us. But from there, Mick really just enjoyed the internship.
Mhm.
And so he should have, in a typical situation, would have moved on to another field placement. But he requested to stay here because he was learning a lot, and wanted to just kind of dive deeper with us because we were rapidly expanding at the time that
Yes.
Mick first came here. I know when he came, like you said, we didn't have a website, we didn't have much presence out there. We've now since gotten our mobile trailer, we've started our adopted grandparent
Mhm.
program. But another big thing that Mick is really interested in wanting to go into with social work is therapy.
Mhm.
And we try to, with any intern, whatever your interests are and what you want to get your experience out of it, to tailor the internship to that, give you those specific clients. And so with Mick coming back for the third semester, it was with the understanding that we would focus on more of the therapy side.
Mm.
And so one of the things that we do with our clients is if they don't have the ability with transportation, or they don't have a phone or internet or whatever, or don't even know how to work it because they're elderly, then we come out with our laptop and we provide telehealth services. Like, we don't do it, but we partner with other agencies. We set it up for them. And so we've specifically brought Mick to those clients, so that he can experience that. So kind of tell us about that shift in the third semester.
Like Lauren said, that's one thing that they made sure to do with me, was to try to find a way to tailor that experience for me so I could have some clinical experiences with watching people, which, of course, the clients had to give us consent to let me,
Mm-hmm. Sit
observe or sit in,
in.
and just see these different clinical practices being given to the people through the devices in their home, which was something, that has come about with the focus on mental health and telehealth.
Mm-hmm.
That was a service in itself that was new to me, was bringing
Yeah.
people bringing the services to the client in the home like
Yeah.
that.
And hopefully it's helped because Mick now has a job that he's about to start when he graduates
Yes.
on that more clinical side. So,
Yeah. I mean, and I can say that directly, that the type of stuff that I've learned here, such as in how to document in the way that you need to do, with case notes, and through the watching these clinical therapeutic methods be used with people during their therapy sessions. It directly applied to the part-time job I was doing when I wasn't in school, or at my placement, and now, yeah,
yeah.
um, there I will start that as soon as graduation's over. Practically, they can't wait to put me
I'm
in a
excited for you.
position.
So,
Thank you.
yeah, so another thing about Mick is, and some other students as well, is students have come in and they're not from Tuscaloosa. And as they've learned about the program, they've gotten involved, they've seen the success, they've thought about their own communities and thought, my community needs this. And Mick, though, where he differs from those other students, is he kind of took that extra step. And I think that's where that history of working with the Chamber of Commerce kind of helped Mick compared to other students. But so Mick went back to his community and started talking to people he knew of how can we bring this here. So kind of walk us through your thought process there, how that played out.
Yeah. Like I said earlier, social work is all about relationships and making networking and making connections. And, people, has it so happened in the time that I worked with the Chamber of Commerce, one of the people that I worked with who was on our board of directors, um, it was now in charge of the Walker Area Community Foundation, which is a huge philanthropic entity in my county, and not just in my county, but just in the upper northwest part of Alabama.
Yeah.
They write tons of grants, and they fund a lot of great programs. They actually fund or helped get started where I'm going
Now
to
about to work.
work. Yeah.
Full circle.
So yeah, every day after being, out in the field with Lauren and Brianna, I would drive past the foundation, and so finally one day I was just seeing all this stuff happening, and when you see things happening, you want to be a part of change and you want to
Yeah.
make it happen. And knowing the needs in my community, I thought, well, here's a chance to do it and
Yeah.
put it into action. So, and I had that connection, I had that relationship, so I could just walk in and ask to meet with them, and he was more than happy to rekindle that working relationship and sit down and talk about it with me. And
Yeah.
so I brought to him what I had seen here and how I thought it would be helpful in our area, and he was right on board with it.
Yeah, and so I know from there, he, kind of wanted to learn more, and so he actually came down here to
Hmm.
Tuscaloosa, and came to one of our social work hubs to see how all that works.
Hmm.
And from there, word kind of spread to their ambulance company up in Walker County, and so we even had a Zoom meeting. But the difference you'll find there, there's always barriers you're going to run into, and so with Tuscaloosa, we have, of course, an ambulance company, but we also have the fire department with their own rescue trucks and all of that. And the difference with up in Walker County is that it's a for-profit ambulance company
Yes.
up there. And so it kind of caused an issue of, yes, we want to reduce the overuse of 911 for things that aren't necessarily emergencies, but that's also going to affect the ambulance company. Like, they've got to keep their business open.
Exactly.
And
You got
so
to
it
follow the
made
money
it
sometimes.
right. And so it made it just a little bit difficult. And while the ambulance company was on board, it's like, how are we going to do this but not mess up our business?
Mhm.
And so from there, it kind of progressed into, okay, let's talk to the leaders in Walker
Mhm.
County. And so kind of tell us about what the next steps.
Yeah. And like Lauren said, and since our paramedical service is a for-profit, and we had to kind of get to the people who run the community, and that's where my Chamber of Commerce connections came in again.
Yes.
And this is another interesting aspect of social work is just how much business leaders and people in the community contribute to social work behind the scenes.
Yeah.
You don't see it and you don't really think about it most of the time, but they're all nonprofits have a board of directors to make sure everything's
Hmm.
being handled properly, and those are usually run by, or those positions are filled by people within the community, like business leaders
Yeah.
and local people in elected places. So at the Jasper Rotary Club, they my contact Paul Kennedy was able to get together those are the people, the movers and shakers of Walker County, the mayor and city council people, business leaders, people who would sit on the board of a program like this, and that would help possibly find funding. They were there to hear a presentation uh, and it was a long time in the works, and that was
Yes.
part of how I got to stay as well.
Yeah. Yeah.
Was it took a good almost year to get this meeting set up because it had to go through many stages.
Yes. So yeah, Mick got basically through Paul Kennedy, had us come up to Jasper and speak to the Rotary
Mhm.
Club. And like you said, the mayor was there, city council. And so to all of them, we just kind of gave the spiel of what is our program, what's the success we're seeing, how does it all work? And they all seemed, I would say, pretty receptive,
Oh
excited,
yes.
had a lot of questions, of course, the logistics of things. And so that is kind of where we're at with it. At this point, it's not up and running in Walker County or anything, but the seed's been planted, the conversations are beginning to be had. And that's
Mhm.
anything with starting a new
Yes.
program, you've just got to work your way with the small steps.
Yeah. You
So we're
got to
excited to
yeah,
see.
basically.
Yeah.
Yeah. So yeah, I mean, it was one community helping another,
Yeah.
and that's what social work is about. It's helping everybody as much as you can.
Yeah. So we're excited to see where it goes and what it leads to up in Walker County. And for all we know, Mick will be involved with that when he goes back home.
Yeah,
So
I'm hoping to.
we're so excited for you, and we are going to miss you, Mick. We hate that it's your last day, but we so appreciate you doing this podcast for us.
I'm always happy to help, you know that, and it's a bittersweet day for me.
Yes.
But graduation and real life's calling, so I gotta go
That's
back.
right. That's right. Well, we're so thankful for you and listening to us. Our next podcast, we're actually going to meet with a member in our community that we partner with in her church. So we're so excited to have her for our next one. And hey, if you're enjoying listening to this podcast, we would so appreciate it if you would like, subscribe, share it out. The only way we can really get the word out there is through you guys and through y'all that are enjoying this. So if you don't mind, we would appreciate it, and we will see you on the next podcast.